Reproduction. This is for male anatomy. We start off with some general stuff. So the gonads, remember, are the primary sex organs. They are testes in males, ovaries in females. The gonads produce sex cells, right, or gametes, and secrete or produce hormones. Males, for the sex cells that are produced from the gonads, are sperm for males and ova or eggs for females. Testosterone is the hormone that is produced mostly by the testes in males, but is also produced by the ovaries in females. Testosterone plays a key role in the development of male reproductive tissues, such as the testes and prostate. Also promotes secondary sex characteristics in males. Estrogen, again, produced by both males and females in larger amounts in females. Plays an important role in the menstrual cycle and also promotes secondary sex characteristics, primarily in females. Secondary sex characteristics for males: growth of body hair, including under the arms, abdominal, chest, and pubic hair. Loss of scalp due to androgenic alopecia can occur. Great mass of thigh muscles in front, or the femur, the quadriceps. Growth of facial hair, enlargement of the larynx. That is the Adam's apple, and deepening of the voice. Increase in stature. Adult males are taller than adult females on average. Heavier skull and bone structure than females. Increased muscle mass and strength. Larger hands, feet, and nose. Larger bodies. Square faces, broadening shoulders and chest. Shoulders wider than hips. Increased secretion of oil and sweat glands, often causing acne and body odor. Coarsening or rigidity of skin texture due to less subcutaneous fat. Lower body fat percentage, and enlargement or growth of the penis. Secondary sex characteristics for females: enlargement of breasts and nipples, growth of body hair, most predominantly under the arms and pubic area, greater development of thigh muscles behind the femur, that's the hamstrings, widening of hips, smaller hands and feet than men, elbows that hyperextend 5 to 8 degrees more than men, rounder face, upper arm approximately 2 centimeters longer on average for a given height, changed distribution of weight and fat, more subcutaneous fat, and fat deposits, mainly around the buttocks, thighs, and hips. Labia minora or minora, the inner lips of the vulva may grow more prominent and undergo color change. So the male, the side view. Here we have the bladder. This comma-shaped structure is called the epididymis. Of course, this is the penis. That is the prostate. The scrotum that holds the testes, the seminal vesicles. And there's the testicles, which include the seminiferous tubules, which is where sperm birth takes place. Or gametes are produced in males. The urethra is the tube that extends from the urinary bladder to the end of the through the penis there to the exterior. The vas deferens, Cowper's gland. Now this is the testy. And you can see the seminiferous tubules there. This little coil-shaped structures right here. The epididymis is this comma-shaped structure. So the sperm undergoes meiosis here, as we've learned about, and then is matured through here, and then goes out through the seminal vesicle. the testes contain seminiferous tubules, sperm birth, tightly coiled structures, function as sperm forming factories, produce 350 to 500 million sperm each day. Sperm travels to the epididymis, where it is stored until it is time to leave the body. Interstitial cells produce testosterone. So again, the testes, and the seminiferous tubules and the epididymis. The epididymis is the comma-shaped structure, tightly coiled tubes, functions to mature and store sperm cells at least 20 days. Expels sperm with contractions of the muscles in the epididymis walls to the vas deferens. The vas deferens carries sperm from the epididymis to the ejaculatory duct and passes over the bladder. This ends in the ejaculatory duct, which unites with the urethra. And just a little note here, a vasectomy is the cutting of the vas deferens at the level of the testes to prevent transportation of sperm. So this is if a person doesn't want to have kids anymore, they're done having kids, they can have a surgical procedure called a vasectomy. So here you can see the vasectomy, the vas deferens cut down here to prevent that. Seminal vesicles, located at the base of the bladder, produces a thick secretion, about 60% of semen. Contains fructose, or sugar, vitamin C, and proglastins, other substances that nourish and activate sperm. The prostate gland encircles the upper part of the urethra. Secretes a milky fluid, helps to activate sperm, enters the urethra through small ducts. This is the prostate gland right here. Cowper's gland, pea-sized gland below the prostate, produces a thick, clear mucus. This cleanses the urethra of the acidic urine that's in it. It serves as a lubricant during sexual intercourse and is secreted into the urethra. So here's Cowper's gland right here, this little pea-shaped structure. So it sends down the fluid there to cleanse the urethra. Semen is a mixture of sperm and accessory glands that I've just talked about. Seminal vesicle, prostate gland, Cowper's gland, secretions. Advantages of accessory gland secretions are, fructose provides energy for the sperm cells, helps protect sperm from acidic environment of the vagina, and elements of semen enhance sperm mobility. So these are things like the proglastins. External genitalia, so we have the scrotum, and this is the divided sac of skin outside the abdomen. This maintains a temperature at least 3 degrees lower than body temperature to protect the viability of the sperm so that they survive. So the scrotum, again, is what holds the testicles. Continuing on with the external genitalia, we have the penis. This delivers sperm into the female reproductive tract. Regions of the penis are the shaft, the glands, that's the tip of the penis, and for some people, the prepuce, or the foreskin. This is a folded cuff of skin around the end. And it can be removed by circumcision. Why circumcision? Parental decision. Religious or cultural traditions. Many Jewish and Islamic families practice circumcision as a part of their faith. Some believe it allows for easier hygiene. It's easy to keep the penis clean, although it is very easy to keep an uncircumcised penis clean as well. It prevents the spread of STIs. Some people believe that, like HIV. Although safe-sex practices are just as effective for men who are uncircumcised. So many families within Africa practice circumcision for this reason. The corpus cavernosum fills with blood to become erect in preparation for sexual intercourse. So this is the corpus cavernosum here. So humans do not have a bone in there, some animals do. but it just fills with blood to make the penis erect. Urethra extends from the base of the urinary bladder to the tip of the penis. Okay, carries both urine and sperm. Sperm enters the ejaculatory duct